Being in a dental family and growing up watching my father practice in pediatric dentistry for 44 years, his career overlapped mine by roughly 20 years. And then I have an older brother who graduated 5 years before I did and practiced 35 years. And to me, it boils down to 3 points of motivation. First and foremost, people that go into dentistry are altruistic by nature and they want to help other people. And so they can help other people with their doctoring and their microsurgeries. Secondly, they want to feel fulfilled. They want to feel like they're making a difference in their community, a difference with their patients. I call that the fulfillment factor. And lastly, they want to profit from their efforts. People that take the time and put in the effort to go through the education experience necessary to get their dental degree are usually motivated to make a good income. It's interesting though, it depends upon where the dentist is in their career, which of those 3 items is the top priority. When I graduated from dental school, I owed about $17,000 in education debt, and I felt that I was buried economically for life. It is common today for graduating students to have $250,000 in education debt. That debt puts them in what I call the survival stage of practice for a much longer period of time than occurred in my day. I would subjectively say that in my day a dentist would be in the survival stage of dental practice, assuming they didn't make any foolish decisions, for about 5 years after graduating from dental school. Today it's closer to 10 to 15 years before they can move from the survival stage into the second stage of dental practice, which is called growth. Dentists tend to spend the brunt of their career in growth. It's where they're seeking to increase their patient base, increase the number of treatment modalities that they perform, and of course increase their income. So when they are in the survival stage, their primary focus has to be profit, because if they're not profitable, they will not survive. When they reach the growth stage, profitability moves into the number 2 position, and helping others becomes their number 1 priority. Fulfillment still stays at the bottom of the list. Unfortunately, many dentists don't reach the final stage of practice. That's the stage where the practice is largely turnkey. It is meeting the dentist's financial goals. The dentist is able to work the hours that he or she wants and is able to do the procedures that he or she wants to do on the patients that they want to treat. And fulfillment becomes the biggest factor, the positive feeling that they get from doing something special that they are uniquely talented to do. So by the time they reach the fulfillment stage of practice, fulfillment itself is the most important motivation, helping others is the second motivation, and profitability falls into 3rd place.